Yeah, Gerard Mansour. I'm the Commissioner for Senior Victorians and Ambassador for Elder Abuse Prevention.
Now, I believe your position is only in Victoria, is that correct?
Yeah, it's interesting. Across Australia, our Victorian government's the only one that's appointed a commissioner of my type. There's different roles that different commissioners have, but mine's really about giving a voice to people as they age, and so I spend a lot of time out in the community with Victorian seniors and present a voice on their behalf to the Victorian government.
Now, also your position was expanded in recent times. Can you tell us a little bit about that?
Yeah, so as part of the government's response to the family violence reform, they were keen to make sure that there was a focus on older people and elder abuse, so they've also asked me to play a role as Ambassador for Elder Abuse Prevention.
Okay, now your presentation here today, we're here at the intersection really of two royal commissions into mental health and into the aged care system. What did you want to present on today? What were your main points?
Yeah, I'm very fortunate to spend a lot of time out with older people, and so I worked my submissions both to the Aged Care and the Mental Health Royal Commission came out of special workshops. I had 2 workshops where I brought together lots of older people and their carers and had an opportunity to hear firsthand their life experience, and so today I was able to talk about some of the most common themes for that. So from a mental health point of view, one of the real compelling things is that the strengths of our current system are also in a way the weaknesses, that there's some fantastic practice, some really highly skilled professionals, some really motivated GPs that provide support, but unfortunately it's not the same experience for everybody, and so some of the gaps are those very things: not being able to navigate entry into the system, not being able to find GPs who value the importance of social connections, so of course finding challenges and over-reliance on medication rather than looking at social support programs. The importance of, as people age, the ability to navigate access to other supports, so whether it's a gambling addiction, whether it's drug and alcohol, or whether it's a need to move to the aged care system. So those whole interfaces between the systems are critical for us, and I think one of the most important things for me is to remember that people with mental health issues still need a life, and they need quality of life. They need an opportunity to feel fulfilled and have meaning and purpose in life, and so I think that's a really important part of the journey, to remember it's not just supporting an issue or a condition, it's about managing an experience of getting the best quality of life.
Isolation was a big thing that you raised, and you have done a report on isolation. Can you talk to that? What are its impacts? And you talked about it for consumers, people with lived experience and carers.
Yeah, so isolation and loneliness, I did a report for the state government in 2016, and the government's moved to a number of initiatives since that as a part of its response to my report. What I learned from the international literature is about 10% of people aged over 60 are going to actually deal with chronic isolation and loneliness. And the international research really tells us that not only does it reduce quality of life, but some of the more recent research in America tells that it actually shortens people's lives. And so I think there's a compounding impact where people also have mental health issues. There can be a drift into chronic isolation and loneliness, and so part of the focus, part of the voices I heard very clearly is the importance of having good, strong, robust access to social support programs, and that system-wide existence of those is not at the level that we need. So there's some really good pockets of examples, but we don't have a good statewide system. The other thing is the interface with other programs. I think a lot of the social support that people need exists already in some way, but we don't have pathways into them. Like, we've got fantastic men's sheds programs, University of the Third Age, but often you find that a carer who is so dominated in their life by dealing with the needs of the person they're supporting just doesn't have the time to find what programs and supports exist in our community already. So a lot of the stories I heard were about breakdowns in pathways, navigation, the ability to find the right thing for me to give me meaning and purpose in my life at the same time as I'm a carer for somebody with mental health needs.
So where does that lead us, that breakdown in the pathway? And as you said, your role has expanded out of the Royal Commission into family violence in Victoria, which was a landmark report, and we have seen some areas of reform, or many areas of reform, some areas of success. What are your hopes? What are the priorities, do you think, for this Royal Commission, and what would be your top asks of them?
I think trying to work out what are the top asks is a little bit more complex. One of the things I shared today is that older people have many different roles when it comes to mental health, and I couldn't just pick three for overall. So if I put it this way, there's those people who are growing old with mental illness, and they're going to move from the adult system into the aged person system. So for them, how do we maintain enough consistency in the type of structures that are available? How do we have enough continuance? And some of the feedback I got is, what is it about my needs that change just because I turned 65? So I think one of the really important things to look at is what's the nature and the structure of the adult system and the pathways into the aged person system. Are they working effectively in the right way? So I think the Royal Commission needs to look at that from a systems point of view. Then there's the role and experience of people moving into the mental health area for the first time after the age of 65. And this is dominated by experiences of anxiety and depression. And far too much of the role is an over-reliance on medication. And so for that cohort, we need to particularly look at what are the other pathways into social support programs, looking at initiatives like social prescriptions, where GPs have an empowerment to move into other areas of focus, and our system looks at the needs of the person more broadly, not just through a narrow lens of medication for depression and anxiety. And then there's the role of older people as carers and supporters. Lots of people that shared their stories were actually commenting on the experience of supporting someone who was involved in the adult system. And so older people have an enormous vested interest in the effective operation as a system as a whole. And so I'd come to those areas as looking at my priorities around those key roles and pathways of older people.
That's fantastic. Thank you very much. As our next session sounds like it's about to get underway. Thank you, Commissioner.